Welcome to Ask the Experts. I'm your host, Kayla Murphy. Today we're talking with Dr. Juan Tayler from Digestive Disorder Consultants about colorectal cancer. So, what exactly is colorectal cancer?
When we talk about colorectal cancer, we're referring to tumors that grow either in the large intestine or in the rectum. And we use the term colorectal cancer to comprise the whole area.
Okay.
They tend to be, most of the time, malignant tumors at the time that they are found. Colorectal cancer is actually the third cause of death among men and women over the age of 50.
Oh, wow.
But with appropriate screening, we can find them at early stages and probably cure the patient most likely.
What are some risk factors for colorectal cancer?
Significant risk factors, number one, I think that it's family history. Mm-hmm. We know that there are determined syndromes that are passed from one generation to the other, increasing the risk for colon and rectal cancer.
Okay.
Number two factor appears to be diet, although nothing is definite about that. A high-fat diet, a diet rich in red meat appears to be a significant risk factor. And like any other malignancy in the body, the lack of exercise or the lack of activity appears to be also a significant factor. Other factors in the diet also include the lack of plenty of fruits and vegetables.
Okay. So it sounds like eating well, staying active, those are really going to help decrease your risk.
Exactly, yeah.
What screenings or tests are available to help you detect this?
Routinely, the primary care physician is supposed to be doing physical exams on the patients, which include a rectal exam. Mm-hmm. That usually is performed in men and women, usually until they reach the age of 40. Mm-hmm. Sometimes it happens earlier if they're having any problems. Part of the screening also is your general physical exam every year with your primary care physician, and normally the primary care physician will perform blood work. Mm-hmm. And one of the indicators in blood work will be the presence of early anemia.
Oh, okay.
Yes, so if a patient is anemic, a patient should be referred for further evaluation.
Okay. What about colonoscopies?
Colonoscopy is the ideal tool for screening for colorectal cancer. It's the most effective one.
Okay.
The disadvantage of colonoscopy is the fact that it's an invasive procedure that requires sedation and also the cost related to that. But it's definitely, all studies have revealed that clearly is the most effective one.
At what age should you get a colonoscopy and how often?
If the individual is healthy, it has no problems, and there is no family history, the first or index colonoscopy should be performed at the age of 50.
Okay.
If a person has a first-degree relative with colon cancer, that's it, father, mother, brother, or sister with colon cancer, it should be performed at earlier age, probably around the age of 40. What we normally do is we use the age of diagnosis. For example, your father, God forbid, got colon cancer at 60, you start at 50, but if he had it at 50, you should start at 40. So we use that 10-year line to try to figure out.
Okay.
And again, it's important that everybody talk to their family. It's not pleasant, but it's very important and very helpful to talk to the family. What happened to grandpa? What grandpa died of?
Yeah.
Because with that type of information, we can see if perhaps there is a hereditary form of colon cancer.
Yeah.
There are cases of familial polyposis where members will inherit this syndrome in a dominant fashion. They will start having polyps when they are in their teen years, and if they are not detected earlier, they can die from colon cancer at the age of 25 or 30.
Oh my goodness.
So it's important to listen to the old, histories in the family. Yeah.
Family history is really important.
Yeah.
How do you diagnose colorectal cancer?
There are several ways that we can do it. The most common one, again, is performing the colonoscopy. You also have new technology available in our health system for patients that are ill or cannot undergo sedation for colonoscopy because of multiple serious medical problems. What is called the CT colonography or virtual colonoscopy.
Oh, wow.
On this examination that is non-invasive, the patient is given a preparation, and then the colon is scanned in a special manner with digital technology to detect polyps or masses in the colon.
Wow, that sounds really advanced.
And that has been available now for at least 3 years now.
Oh, wow.
Yeah.
What symptoms should make you immediately think, I really need to go to my doctor and get this checked out?
Just, having blood on the toilet paper after a bowel movement should alert you that it's something that needs to be looked at. And again, it doesn't matter how young you are. If you see blood in that situation or in that scenario, you should contact your primary care physician. You have other symptoms. Unfortunately, the other symptoms suggest probably advanced disease, abdominal pain, a significant change in your bowel pattern. What I'm referring to, if a person was perfectly regular going to the bathroom every day, all of a sudden he cannot go for 3 or 4 days, or starts having diarrhea that has no explanation based on diet or medication or any other problems, it should call the attention of their primary care physician. And again, I mentioned to you before that the detection of anemia in a routine blood work also requires evaluation. Don't be afraid to come forward. We have the best facilities in the area to do screening colonoscopies for everybody. A screening colonoscopy is a benefit that is included in most insurances, and even in patients that does not have insurances, the health department help those patients to get their screening colonoscopies.
Great, thank you so much for coming and talking to us.